everyone. Hello. I love the enthusiasm. We have to flick on and off the lights like kindergarten. Yeah. Good evening, everyone. Welcome, welcome, welcome. Very nice to see everyone. Thank you all for being here at our annual APTA Oncology business meeting. We are going to officially call the meeting to order. I don't have a gavel, so we'll do that and call the meeting to order. So thank you for all being here. We're going to be doing some introductions first, and then we have a very exciting show for you guys to kind of talk a lot about all things oncology. And probably the most important thing is this is not a one-way conversation. We want to hear what your guys' thoughts are, what you're hearing in clinic, what you're seeing, what are your barriers and facilitators to patient care. So start thinking a little bit about that. It should work. Maybe I'm not close enough. And I have to kiss the microphone. I know nobody tells me I'm not loud enough. So thank you for bringing that to our attention. So my name is Chris Wilson. I am the president of APTA Oncology, and I have the honor to be serving all of you and our membership and our patients. So thank you for that honor. And I'm going to allow the rest of our board of directors to announce and introduce themselves.
Hi everyone, I'm Franny Westlake. I'm vice president.
Hello, my name is Emily Compagner and I'm the secretary.
Hi, I'm Paula Stout. I'm the member at large.
Lorna Griffin, treasurer.
And probably our first order of business is, Madam Secretary, do we have a quorum?
Yes, we do.
All right, we have a quorum. Thank you very much. So our first official order of business is going to be election results in open positions, and this would be Betsy Campione.
So I could talk about the open positions. So for this next year, we will have president-elect. I can yell. My mom voice. So we have president-elect, treasurer, member at large, and the nominating committee member. So we can have those job descriptions available to you. I'm the outgoing nominations chair, so Amy Thompson will be taking over. She recently had twins, so she's not able to be here with us. So she's doing something better. You'll be able to reach out to her to get those job descriptions. So it's really exciting. I know that sometimes it can be intimidating to take on a new role, but these are really vital positions, and some of the conversations that we've been having over the past couple of days is just the challenges in getting individuals to take on some volunteer roles. So I think oftentimes it's a little bit scary to take something new on. So please reach out to people that are currently in these positions to really talk about what's the time commitment, what are the expectations, because I think sometimes it's scarier than it really is, and it might be less than you think that it is, especially if you're really efficient and willing to work and collaborate with different groups. So it's really important for moving the academy forward, and I think it's important too that if you're even unsure or new to the academy, those are the people that we really want to harness to, because it's fresh ideas, diversity of thought. You're going to bring more innovation to the group. So I really want you to think about running for those positions.
Thank you. Any questions for Betsy? Thank you to Betsy for her service and for the entire nominating committee. They have such an important job to really help us fill all our positions. If you'd like, there are seats. Unfortunately, they're in the front, so you're welcome to come and sit in the front if you like. I know it does my heart good, no matter whether you're a first-year PT student or many years into your career. Some people just don't want to sit in front and look up the instructor's nose. So we're trying something a little bit new with the membership meeting after member feedback, and we do really value member feedback, is we are recording this session. So if you have any words that are stronger than PG-13, you can say them outside, otherwise we'll have to edit them out. And this will be posted on YouTube for people, because we're hearing a lot of folks who couldn't come to this meeting, and they have a little bit of fear of missing out. And we miss them, and we welcome them to the meeting as well. So thank you guys for that. So next step is we're going to be doing announcement of the award recipients. And then we're going to be doing the financial report. And then I think we have a guest from the PT PAC that will be able to say a few words after we do the financial report. So that's kind of our next items of business. So all of our award recipients are so well deserved. This was a really, really competitive year for all of our awards, and we're so thankful for all the nominations and all the awards. We're going to be reading them here, but they are going to be officially recognized at the Celebration of Life, which will be starting promptly at 8 p.m. Unless this meeting runs long from spirited debate and discussion, then it'll be whenever we're done with this. So I'm going to announce the award recipients, and then we will recognize them when we get to the Celebration of Life. So for the Jerry F. Walton Service Award, Shayna Harrington has been recognized for that. So don't see Shayna here yet, but that's okay. And then we have the Deborah Flomenhoff Humanitarian Award. Dan Stevenson is recognized for that award. And we have Research Award. We have 2 Research Awards. One of them was from someone we already heard from just recently, Elizabeth Betsy Campione. Congratulations. And the other Research Award is Meredith Wampler-Kuhn. Congratulations. For our Student Research Award, Simon Ho has been recognized. Congratulations. And the Stephen Gudis Award for Outstanding Publication in Rehabilitation Oncology. We have a whole team here, and I'm going to read each of their names. Joy Cohn, Shayna Harrington, Stephen Wexler, Jeanette Lee, Jet Lee, Dan Malone, let's see who else, Mary Fisher, and I think that's it. Everyone has like big, long, board certified specialists. And they had make sure I didn't miss anything. And the article that they were recognized for was Screening and Assessment of Cancer-Related Fatigue, an Executive Summary, and Roadmap for Clinical Implementation. So congratulations again. And then last but not least, our next award will be the President's Award, and it's our honor as president to be able to, and I say our, like not like Your Majesty first person. This is Laura Sheridan and me as well. So there are actually 2 people. Is Franny Westlake. So congratulations, Franny. All right, so we will have Lorna Griffin provide us with a financial report.
Sounds good. Maybe you take the mic.
Yep.
Yeah. All right, stand up. All right, so my voice tends to project, but if you can't hear me, let me know. So this is our financial report ending December 31st of 2023. That's our most recent financials. Our total assets are $358,909. That's compared to $346,000 in 2022, with a cash balance of $288,575 and Wellington Investment Fund of $70,334. Our total revenue year to date for 2023 is $179,033, whereas our total expenses were $155,513. Thank goodness. For an operational gain of $23,520, compounded by market gain of $2,932, bringing us to a total net revenue for the year of $26,452. We were budgeted for a loss of $19,000. So good work. I will make mention in the budget, at least from the budgetary aspect, there's many people and efforts that really contributed to that budgetary gain, but I will make mention of 2 distinct regions that I saw budget impact for the past year. Definitely revenue sources. The CSM was really great, $55,000 from last year. Regional course registration, great work, $14,669. Editorial fee allowances, $21,000. Royalties, $30,324. We did fall short in membership, $51,322 versus a projected $56,000. We need to do better there. So membership, recruitment, engagement, retention, everything. Expenses, contractual fees, and obviously supplies, and web maintenance fees were a little bit higher than anticipated. We still do a really great job in member travel. We are only at about $12K. less than budgeted. We had less people traveling for Leadership Congress, CSM, but as I've talked about in many meetings online, that is a double-edged sword. We want people to go. We want to hear your voices. We want to see you at these leadership engagements. Special shout outs, I'd like to really, the education efforts of our academy and publication. Our Head and Neck California course, just phenomenal, $4,855 out of $5,000 projection. Virtual courses, one from each SIG, brought in $9,814, and our publications brought in $15,234 of a projected $7,532, double the revenue. So huge shout outs. So it's just great to see the efforts. I'm glad to see that we're on track for all these positive gains. Just recognize that as we talk today, the strategic planning, there's a lot of efforts that we need to continue to really make some contributions financially so that we can actually support research, support our strategic mission and planning, and that's gonna take even more efforts. So let's keep this effort going and let's even hit the accelerator if we can.
Any questions for the treasurer? Or treasurer's report? All right. Yeah, and thank you to Lorna for her hard work. It was a little bit of a challenge this year because we had a lot of unpredictable nature, but we do have a budget neutral budget. I'm not a big fan of running deficit budgets, and we were successfully able to kind of balance the budget. And usually, if we are conservative enough, that usually means some type of budget surplus. So thank you for your hard work and efforts on that, and attention to detail. So I never told my wife, but right, my wife took my checkbook away when we got married because I was balancing everything up here. So I'm glad I'm not the treasurer and I have somebody good here. So I'd like to invite our PAC representative, Allie. Are you ready to speak a little bit? Come on up.
Do you want me to?
Yeah, it sounds like some people in the back prefer the microphone.
Hi, everybody. Thanks for having me tonight. As you might recognize, or if you're not familiar, I am one of the redcoats. So I'm a PT PAC board trustee, and my job is to ask you for money. So I'm here to tell you why. Or to talk a little bit about the why. Because PT PAC's not sexy, right? I mean, I was on the board for the private practice section. That was way sexier than this. However, this is really, really important and it affects every single member in our association. So some of the legislation that we have coming up this current year is really big. A lot of it revolves around Medicare because it's federal legislation, right, versus state. I have some papers on the back table that go through some of this legislation. You can also go to the APTA website and look under advocacy and you'll see stuff about each one of them. I've already signed a call to action letter since I was here to send to my congressperson about one of the Medicare bills. So when you get those calls to action, it takes about 30 seconds to respond. The letter's already written for you. It's pre-populated with your legislator, your representative, senators. If you can add 2 sentences to personalize it, that's awesome, but if that would stop you from sending it, then don't add them. Just hit the submit button and that goes. And your congressperson really needs to hear from their constituents to believe that that bill matters to the people who voted them into office. So some of the things that are coming up this year, a big one I think is administrative burden. We have bipartisan support on a bill to eliminate the physician's signature on the plan of care, which would be huge. We all know how hard it is to track those plans of care and get them back into our offices. So if we could stop doing that, that would just save a lot of cost in our front desks. A big objective of APTA is to get Congress to look at overhauling the whole Medicare fee schedule. As we know, it's wackadoodle. And it is the reason that we're having to work at this cut that comes up at the end of every year. And for those of you who know that 3.4% cut is still hanging out there from Medicare, please don't think that APTA isn't trying. We have such a divided Congress. They haven't passed the financial package yet, so they can't address the cut. So they keep kicking it down the road. Used to be kick it down the road a year, now they're kicking it down the road by months at a time. So you may have seen that you keep getting a call to action for that. It's because we tried to address it before the end of the year. They kicked it down to January. We tried to address it in January. They kicked it down to February, and it is now kicked down to March, and will be our last opportunity to try to get that 3.4% retroactively eliminated. So when you get that call to action, please, please, please sign it. Tell your representatives how much that means to you and how much loss it means for your business and or your paycheck. And then you guys last year, there's more in there than that. There's a lot more, but I won't go into all of it because I know we have a big meeting. But the Oncology Academy in particular really benefited from the legislative efforts last year when the lymphedema ban, the law to allow lymphedema bandages be paid for finally was passed. I know there's probably some issues about addressing how it gets paid and all of that, but at least it's in legislation now that you do get paid for that. So your academy in particular was a beneficiary of that. So when we talk about contributions, none of that happens unless money goes to the PAC. We have to pay legislators. They come, this is an election year, they're already coming. They recognize PTs are important and our PAC is important. So they're coming and asking us for our support, which then gives us a great opportunity to talk to them about our bills and get their support. So about 6% of the entire APTA membership contributes to the PAC. Actually, it's 4%, 6% of PTs, 4% overall. Your section, your academy, contributed, you had a 10.9% participation rate in 2022, and it dropped to 10.2% in 2023. Even though, again, you guys had legislation that really impacted you directly. You're number 11 out of 18 academy and sections in terms of your participation. So I'm hoping that we can get that participation rate up a little bit. And all of you here, you guys care, you're involved. You probably all give something, at least I hope you do. My request is that you ask your colleagues, when you go back to work next week, you take, there's envelopes on the chairs, and if there isn't enough for everybody, I can get more, and there's more at our booth. But those envelopes have a QR code on the back. You just need to flash on that QR code and you can donate right there. You can also put money or a check in those envelopes and leave them with Chris or Lorna. They'll collect them at the end of the meeting tonight and bring them to the booth tomorrow. And you can also visit our booth tomorrow. And as an added incentive, and because I'm so passionate, I'm willing to look silly, we have duck hats because we are getting our ducks in a row with the legislature. So while supplies last, anyone who makes a donation may have a free duck hat. So it is while supplies last. They were flying off the shelves today. As you can see, they're cozy. Grandkids and children love them, as do Halloween people. And there are also free little rubber duckies at the booth. So if you donate tonight, we will trust you to come by the booth tomorrow and say, hey, I donated, can I have my hat? And again, while supplies last. So if you have any questions, I'll be at the back for just a few minutes. I have to get to our PT PAC event, so I can't stay, which is why you need to give the envelopes to these guys. And thank you so much for your support. I really appreciate it.
Thank you. Bessie, question, comment?
I'm gonna actually ask Paula if we can put her on the spot for a second, because I think I didn't have a great realization of how important this money was until I was peripherally involved with the work group that Paula sat on, that worked with the advocacy group for the Lymphedema Treatment Act. Can you just share maybe just the manpower? I mean, Andrew was amazing, the individual that we worked with. Are you willing to just share with the group, because that might incentivize people if they have a little bit to donate?
Definitely. You know, I'll always
Sorry,
talk,
Paula,
right?
to-
No,
which one
it's
was
good.
fun?
I love to talk about that because that's something we've been working on for years. And Betsy, you were instrumental in developing that work group as well. But yeah, Andrew Amari is our payment specialist that worked on this with us. And so we had the wonderful opportunity to sit before CMS, a panel of 5 of us, probably 5 times this last year, to say specifically, okay, yeah, now this is passed, but how do we want that to play out? Yeah, you say you're gonna pay for garments, but does that mean one a year? Does that mean you're gonna pay $20 toward a garment, or just, you know? And so we had the wonderful opportunity to say, this is what we want. And Andrew, you know, being with APTA staff, and he's a lawyer by trade, was able to really help us get our ducks in a row to make sure that because you know, when you get that opportunity, you get 30 minutes, you know, so each of you can say a quick blurb, so we could say, okay, we want this many garments, we want this many nighttime garments, we want, you know, every 6 months or whatever. And so that worked really well. Over the next year, there will continue to be changes, because even though, you know, it was passed in 23 to go into effect in January of 24, that whole year was planning how to do that, and you know how things work. So they already, when we met in December, CMS said, okay, we see the other things you're asking, and we're going to continue to work on that over the next year. So we need anybody who wants to be involved in that. But APTA has definitely supported us. Is that kind of what you're getting at?
I think what he was able to do was take this hundreds of pages worth of documentation that came to us from CMS and was able to distill it down into the components that we really needed to talk about, that we needed to address. He's probably close to being an expert in lymphedema at this point in time, but he really did that hard work that sometimes it's hard for us to find those personal resources to do. So he was able to distill it down, really pulled that content, create it into digestible bits of information that then the work group was able to take and support in a really effective and meaningful way. And he really worked with them so that that time could be used effectively. And I can say, having sat through multiple of those meetings with different organizations, it was very well organized, and I'm not sure that, and it's not a discredit to anybody that was on that work group, I'm just not sure we could have done it in such an efficient and effective way without having had an expert in payment and reimbursement and advocacy. So that was really valuable, and if we had not had him, while we know the LTA is not perfect, we still had our voice put out there in a really positive way. So that's what some of this money does go towards.
And every single bill is like that.
Yeah.
Every single one. And so I really appreciate that. I appreciate you.
Yeah, and he can weed through all of that pages and pages and explain it to us, like, you know, in this couple paragraphs. So that was wonderful. So thank you, Betsy, for bringing that up.
Perfect, thank you guys. And I do have my $100 bill that I'm gonna be donating right after this meeting, but I usually fill out the envelope while they're talking, but I actually have to pay attention. So I'll fill it out afterward. That way we can kind of get the ball rolling, and it doesn't have to be that much. It can be $5, $20, whatever you can afford if you're a student. You know, we understand sometimes it's okay to do a little bit less, but every little bit helps, and that really means that our voices are being heard, and our collective voices, and that's really what the power of APTA is. We can't do this alone. We have to kind of do it together as a collective group, and the more members that we have, and the more active members that we have, the more power we have in Washington and our states to be able to make change for the better for our patients. So I'll get off my soapbox now. So do we have anyone from the foundation here yet? I don't think so. Okay. All right, so we're going to shift over toward the President's Report, and this is where we kind of talk for the most part a little bit about some of the initiatives and things that are going on in the Academy and things that are affecting our Academy. So yesterday evening, some leaders from the Academy engaged in what we call our strategic planning effort, and it's really kind of to start thinking forward about what the next 3 years and will encompass, and what we want to accomplish, and what we want to focus on. There were a lot of ideas that were really discussed. Some of the big things were, we decided that, you know, we really do need a public policy agenda. And that's one of the things that really focusing on is really kind of declaring, just like the APTA does, what we believe and what we should be focusing on and fighting for. So that's going to be something that we're looking for. We're going to be looking for feedback in, and what really APTA should be either focusing on, and who we should be collaborating with, and who are some of the folks that might be challenging us on some of the things we want to move forward, or even you know, practicing a little bit defensively in some areas. Other organizations or professions that might want to do what we do specifically, and how we might need to to make sure that we're protecting our core practice. Another topic that we're going to hear a little bit about is really the topic of education and mentoring. I think that's been one of the common themes of that session was, from research to helping people to create course content and really, making sure that we're a mentoring organization, that we're, not that we always weren't, but really focusing on being that and welcoming organization to help the next generation of physical therapists and physical therapist assistants really excel at oncologic care. So I don't want to spoil too much of the strategic planning because we still are kind of digesting kind of what we talked about. There was a lot of really deep conversations and very spirited conversations sometimes, but it was all extremely positive. And again, when we get to open forum, we want to hear from you guys. So if you think there's things that we should be doing, or maybe things that we should stop doing, please tell us, because we need to know. We want to hear from you guys. What are the areas that we really have, that you guys need to do the best care for your patients and be the best providers you can. So one of the other events and activities that the Academy participates in is the House of Delegates. We have 2 expert delegates. We have Franny Westlake is our chief delegate, and that's the vice president role, and then Paula Stout is our delegate as well. So they basically go to represent the APTA House of Delegates. Some of you guys maybe haven't thought about the APTA House of Delegates since PT or PTA school when they kind of talked to you a little bit about it. But it's very complex and it's a very busy job, and it really is kind of setting what physical therapy is and what physical therapy isn't at the national level. So it's things like the code of ethics and what really, establishing new specializations and things like that. So one of the big things that the House of Delegates did this past year was they established in 2021 a task force on specialization and consumer awareness. And that directly affects us because we do have specialization, and they're talking about potentially even the topic of subspecialization. So, and that would be kind of commonly known as fellowships. And they're talking about really having a little bit bigger push for fellowships and subspecialization. So we all know that oncology is a specialty area, but they're talking about maybe it's pediatric oncology, pelvic oncology, or some name therewith, and lymphatic oncology, head and neck. So it could be subspecializations like that. Not saying that we have to go there now, but those are things that the APTA is kind of talking about. And some of the reasons for that, I'm going to read this to you. And then they had a consumer research study. Consumers were 63% more likely to consider using a physical therapist if that PT had earned a board certification in a specific area. So 63%. And 60% more likely if they knew the PT had completed a residency or fellowship training program. However, focus group data gathered indicated that most participants were unaware of the physical therapy specialty categories, but they did have a good command of the types of treatments that they provide and conditions that they treat. So we do have some awareness to do, but there is value in that board certification process and that residency certification process. So sometimes specialization is a differentiator for consumers when choosing between PTs. So the Academy is also in collaboration among organizations in what they call a vision for excellence in physical therapy education. Myself and Shana Harrington are serving on the educational collaborative, is what it's kind of called for short, and it's really big picture stuff. It's really kind of saying, what does physical therapy and physical therapist assistant education look like in 20 years? And what do we need to kind of do to get there? So they're really kind of talking, a lot of the discussions have been competency-based education. If you're in academia, you maybe have heard some of those buzzwords about, med schools have kind of, a lot of them have gone toward competency-based education. Can this student perform certain tasks proficiently? And I did speak up at the meeting that we had yesterday because I wanted to know really what does that competency-based education mean for an already kind of underserved practice area like oncology. And that is something that Shana and I really need to stay vigilant on and be that voice, because we know that, yeah, you're gonna come out and feel comfortable with orthopedics, feel comfortable with neurology, cardiopulmonary, but a lot of students are not coming out feeling comfortable with working with a cancer population. So how do we still make that happen? But then it's also focusing through the transition to residency, fellowship, and board certification. So we'll see where that goes, but there's a lot of exciting things to talk about, and nothing is happening right away, so don't, go back to your programs and say, oh, they're changing all education, everything. It's gonna take a long time, and there's gonna be a lot of stakeholders for that. So when it comes back to the House of Delegates, we had a couple of motions yesterday to amend the definition of clinical specialization to also include recognizing defined subspecialty practice. So there is a motion that was passed from the APTA House of Delegates that said, those subspecialties are distinct recognition areas, and that, if academies want to start working towards that, some of them already have, that there is a structure to be able to do that as well. So in Academy, we have not had those discussions yet, but we can certainly start thinking about that in our future strategic plan if that's something that the membership feels like is valuable. And right now we're still kind of getting our feet wet when it comes to residency and specialization as well. So we may want to shore up those a little bit and solidify those before we do that. But that's just one person's opinion. Another one that, again, is the membership and the board will probably be considering amending the bylaws of the APTA, and they were able to permit components the right to seat one physical therapist assistant as a delegate to the House of Delegates. So as a voting delegate, so right now, as we said, it's Franny and Paula. It won't always be Franny and Paula. And we have to consider potentially amending our bylaws to allow a PTA to sit in there. And that's something that several other components are doing and considering as well. But the APTA did pass that, and it is basically part of policy that is an option for sections if they see fit. Another motion that passed from APTA House of Delegates was our support of initiatives to improve rural health. APTA is really focusing on some of those health disparities, and one of them is geographic disparities and some of the differences. And some of you guys who maybe practice in rural areas, or that's part of your geographic practice, maybe recognize that there are some differences, especially when it comes to not just cancer physical therapy care, but basic cancer care. Is there tiered cancer and cancer physical therapy care for folks who are, limited in geographic distribution areas? So, if you're not in a metropolitan area and you're, getting your cancer care from a community hospital, the answer is probably yes. So they're really focusing in on that effort. So I thought I'd bring it forward to let you know that the APTA is working on that and recognizing it and working to level the playing field, so to speak. So the other one is the APTA also worked on charges related to screening, referrals, and authorization for participation in community-based health promotion, injury prevention, and physical activity programs. So APTA is going to continue to provide resources related to care through articles, tests and measures, educational programs, and advocacy related to physical therapy in those community-based health promotion programs. So that could even be lecturing in cancer survivorship programs or cancer exercise programs as it relates to us. So you can kind of look for that. And again, if they're not necessarily meeting our needs, please let us at board know so we can bring it back to APTA and say, hey, you forgot about cancer. Because that does happen sometimes. I don't know if you guys have noticed that or not. So we all need to keep our eyes open and share that with each other so we can do something about it. The next topic I wanted to bring up was the value of physical therapy. I don't know if everyone has seen this document. It is really a great document, and it's something that we're really pushing forth a lot. And we had Tiffany Kending was our representative on that group as well. Tiffany, I don't know if you want to say a little bit about the process or what it is. If not, I don't want to put you on the spot.
No, just quickly, thank you for the opportunity, and thank you to everyone who, when we put out the call for hugs to support the case, to demonstrate the value of oncologic PT, who responded and supported that. That was really fantastic. Thank you to everyone who delivers the care, that creates that value, and we made it into the report just narrowly. There was no whole lot to support us. So we do definitely need to continue to push for research to demonstrate the value of care that we provide. We know it's there, we just need to get it out there. So thank you to everyone. I'm glad that we made it into the report and it is making waves, and please continue to put that out there to continue to support the work that we do and the patients that need our help the most.
Great, thank you. So, yeah, and for those that weren't aware, basically this document was an independent economic analysis that really examined a lot of different diagnoses of physical therapy, and really for our purposes, it was the cost effectiveness of a physical therapy-based cancer telerehabilitation plus monthly home monitoring compared with just monitoring alone. And they actually found a $3,500 savings per episode of care. And that, you know, $3,500 doesn't sound like a lot, but when you think of all the people with cancer across the United States in some of those rural areas, that can and will add up. So that is something that we want to focus on, and I was extremely proud and thankful that we got in there, and that's something that we need to continue to be at the table for some of these things. So thank you for your service for that. So the entry-level guidelines for physical therapist practice, they debut in 2023 and at CSM and now can be found under publications. So this is a new document. If you were here last year, you probably heard about it. This was one of the things when I was in Franny's role as vice president, I got that question a ton. What are we supposed to be teaching our students about cancer in an entry-level program? And after a very long multi-step process, we have an answer. So this is actually in second review in PTJ, so we're hoping that it's going to be a peer-reviewed publication very, very soon. But really it kind of talks about for every program and what we expect a student to be able to do, know, and learn once they graduate from their physical therapy program. Now, right now we were just kind of focusing on physical therapists, but that's going to be one of the things that is going to be our future endeavors is what's the same and what's different for physical therapist assistant programs, because you know they're also in the front lines of caring for patients with cancer, and they need to know this stuff as well. So we need to make sure that they're getting some level of education. And it might be a little bit different than the physical therapist, but it's still certainly worth putting out there. The other thing is several of us did a presentation this morning, some of you guys may have been in there, to really focus in on a toolkit, empowering instructors, clinical instructors, to be able to teach cancer care, and to be able to make sure that everyone is getting that information, and not just in an area where there is a board certified specialist or one of us. Because we know that there are quite a few programs where there isn't one of us around. And how do we empower those folks with a toolkit, how to integrate this within their program as well. So that's going to be kind of the next thing, and we're hoping that in 2024, later in fall, we're going to be hopefully putting out that document and the toolkit of how to kind of implement your education manual. Let's see, a couple other things, and then I'm going to have Brian Spinelli talk, and then Franny talk a little bit here. So the OncoReads. So I don't know if everyone is familiar with what OncoReads is. How many people are familiar with OncoReads? Have you heard that? Okay, some of you guys have, some haven't. So OncoReads is a partnership between the journal and the academy. The journal selects one article per issue that is really our OncoReads article. And basically you can read that article and take for credit a quiz, and then you get continuing education credits you can use for relicensure. In the past, that was hosted on the APTA Learning Center. The APTA Learning Center, they kind of bumped up their prices kind of substantially, to the point where we were concerned that some courses that we put up for OncoReads may not necessarily have made a profit. So we have transitioned that to our learning management system. So on our APTA Oncology website, we have education, and Franny's going to talk a lot more about that. I don't want to steal her thunder, but OncoReads has made the transition to that. So that is kind of it's great, but it's also a little bit of a different, because the APTA Learning Center was not just speaking to us, it was speaking to all physical therapists whether they were members or not. They get some of their education. So one of the things that we really said is we need to make sure that we're strategically pushing Onco Reads and by proxy a lot of our other educational content beyond just our membership, because again, we're already preaching to the choir. We know how important cancer and cancer rehabilitation is, but also making sure that our non-oncology friends feel comfortable working with the cancer population. So you will see probably quite a bit of push, public relations, social media. If you do see Onco Reads or any of our courses come across your feed, please move it forward, share it with your friends, colleagues, enemies, doesn't matter. We want them all to take our courses, so anyone can take our courses. So that has been something that we've been working on. The last topic, and then I'll pass it over to Brian Spinelli to kind of give you some other good news as well, is a national coverage determination. So I have been serving on Moving Through Cancer Task Force, which is American College of Sports Medicine. I followed Nicole Stout in that. And the Moving Through Cancer Task Force is a multidisciplinary task force. And we basically said one of our goals is to make cancer rehab and cancer exercise available for every patient by the end of the decade. And one of the big issues that we identified with that is there's so much research out there that cancer exercise and physical activity is beneficial to our person, to our patients. So is that a shock to anyone? I didn't think so. Yeah, so the big issue with that is we all know that it's the right thing to do, but it has to be financially viable. And this kind of does come back a little bit to our PAC and our advocacy efforts. So what we're working on is what's called a national coverage determination to get cancer exercise as a separate billable code from our traditional physical therapy codes. And that is a extremely critical point, is that we knew that these conversations were going to be happening whether we're at the table or not. And I was in a session yesterday and someone said, if you're not at the table, you are on the table. You're gonna get eaten. Mm-hmm. So we are not gonna get eaten. We are at the table. And one of the big things is we wanna say that if someone is doing cancer exercise, and it could be a physical therapist, it could be a physical therapist assistant under the supervision of a physical therapist, could also be an exercise physiologist, that is not physical therapy and they should not be using our CPT codes for that. Because we've all kind of probably at some point in our career had patients where you want to do a lot of physical therapy with them and they used it all up on, with a chiropractor or some other service. And that's something that we need to make sure that we're protecting. So this is really the goal is this is going to be a separate billable service. We're going to be working on billing codes for that. And we have a lot of momentum for it. So actually just on Tuesday, while I was holed up in my hotel room, watching the snowpocalypse that kind of didn't really happen, I was actually on the call with the White House about this, and I was shocked because we had some people who were the cancer moonshot folks at the White House. I mean, this is all they do. That's their job, is to kind of work through cancer. They had not heard that exercise was important for cancer care. I know, right? Yeah. So this is something that we needed to, so we were the ones who said we're the best kept secret. Physical therapy and exercise really are the medicine, and even focusing in, because President Biden, one of the initiatives is preventing cancer. And the evidence is not 100% yet, but it's growing that exercise affects cancer incidence rates. So getting people out there and knowing about it, and it's really the financial viability of that. So that's kind of the initiative about that topic. So yes, Cindy.
Do you want the discussion during the open discussion?
We can have some discussion now. I was going to ask if anyone had any questions for me.
Well, okay, so the 3 cancer roundtable papers, the one that I think is controversial, and I think we had a lot of discussion around this at the time, which is the clinical exercise phys folks want no medical clearance requirement. All right, that's their agenda, and that's okay if you're only treating people that I would classify as low risk to at most low moderate risk for exercise intervention, right? But that's not who we deal with most of the time. We deal with the high risk and the high moderate risk pretty much all the time. So when you think about coding here, there needs to be some kind of determination around this, because I would bet, I would almost put money on this, they're gonna go with these other codes for no medical clearance requirement.
That's a great question. So yeah, and that's actually, so, and anyone, if anyone wants the national coverage
This is not a bad
determination
thing, by the
document,
way, but
so,
it's an issue for us.
so we are having, right now, the draft is, and this is something that I've been advocating for, exercise physiologists to do the service would need medical clearance from a physician to provide that service. Basically, it would be a prescriptive service. And right now, I'm pushing for, I don't know if it's gonna happen, but for us to be able to do this as a direct access service. In our role as doctors of physical therapy, and then being able to work with our physical therapist assistants to administer that service. Right now, that is not policy of Medicare, as we just heard, that we still need a plan of care signed by the physician, but that bill is happening as well. So I figure it's at least worth the conversation, and it might fly through, and maybe that sets precedent for that not needing the signed plan of care from the physician. So that's kind of the goal right now. I mean, worst case scenario, if we did get this, we might still need to get the darn plan of care signed, just like we do for our therapy notes, and that's
So,
just kind
I
of.
think that's great, Chris, but the clinical exercise science folks are gonna wanna ride on our coattails on direct access without medical clearance.
Well, yeah, and I think that they are having they're not a provider right now consistently under Medicare. And I don't want to get too much into the weeds on this, but they would have to get a special Secretary of Health and Human Services determination to be able to even bill for this service. They do have a couple of other areas where they do carve out that in the Social Security Act. But this is something where, the ACSM has basically said, yeah, we want it to be physician prescription for that service.
I trust you, Chris, it's just we know your agenda.
Oh, yeah. But we're at the table, so we're not getting eaten at the table, so, yeah. Great. Any other questions for me as the president before we bring up Brian Spinelli? All right, I'll certainly be around if anyone has any other questions or ideas. Brian, you want to come up?
All right, I'm excited to announce a new publication, an official publication for APTA Oncology. The title of this publication is Oncology Rehabilitation in Practice. This is going to be an open access, online, editorial, board reviewed publication whose focus will be for the practicing rehabilitation professionals with interest and expertise in oncology, lymphatic diseases, and immune system disorders. So I'm really excited. And honored to serve as the editor, and really looking forward to this opportunity. With ultimately, we're really trying to focus on practicing rehabilitation clinicians with the intent that content in this new publication will be able to be applied directly into clinical practice. And so we're also going to be having the opportunity to publish governance for the academy, special interest groups, but we will be publishing research reports, literature reviews, case studies, case series, product and technology reviews, book reviews, and we're going to take on publishing the columns that were previously in rehabilitation oncology, such as the research roundup and clinical conversations. More information to come, but the goal is to publish our first issue in 2024, and so you can expect communication soon on a call for contributors. So I look forward to seeing all your submissions. Thank you.
Thank you, Brian. And just a couple other notes about that. One of the reasons that this happened is that rehabilitation oncology is growing and it's evolving. That's kind of our peer-reviewed publication. And really a big part of that is working continually on getting indexed in PubMed. And really the big thing when it comes to that is we have to be publishing as much high quality research as we can. And again, not that things like case reports and perspective pieces are not important. They are absolutely important to the profession. They're just not as important for PubMed for some reason. So we're making sure that we have forums for both of those. This is also, as Brian said, it's open access and there will be no publication fees as well. So if you have opinions, if you have sat for board specialization and you have a case report, if you have implementation studies of things that you've done, all of those are going to be welcome. So start thinking about that now, and we'll certainly let you know very soon when that does happen. Again, I also want to recognize Mary Fisher, because this was her as the editor of the journal, kind of seeing that vision, and then also connecting us with University of Dayton, who is actually our official publisher, and they're doing it for a really cheap fee of $0. So it is a win-win. All right, Randy, you want to talk a little bit about our education initiative?
All right, so I'm going to talk a little bit about education, but before I do that, I want to talk about one other thing that came out of the House of Delegates, and I'm going to put Nancy on the spot. So that at the House of Delegates this year, there was also the ability to create a PTA specialty council, which I feel like is really important for our PTAs to be able to start to have a voice and have somewhere that they can share things and hopefully have a vote in the House of Delegates as well. So Nancy, I don't know if you want to share anything more?
Well, it is evolving. It used to be the PTA caucus. It's now the PTA council. There's an elected steering group of about 8 members. It's really an impressive group. I'm new to it. It's the first year that any of the sections or the academies have been requested by the APTA to appoint someone. The states have had reps for years. There unfortunately are, and I found out last night, a number of the academies and sections still have open positions. So thank you for letting me serve in this position. So it's evolving, and I'll keep you updated. I do, and thank you, Chris, to all the shout outs tonight, and Franny too, because PTAs are really an important, we're an important supporting role to all of the work you all do. And I wanted to know, are there any PTAs or SPTAs in the room tonight? Anybody? Okay, so this is one of the problems and one of the key focuses and functions of this coming year of the steering council and group is to increase member engagement and member retention. And we have over, I believe Susie gave this to me earlier, it's over 100 members, PTA members in this academy, many of whom are have actually earned the APP, Advanced Proficiency Pathways, which is a significant achievement. So since there are no PTAs or SPTAs here this evening, I would challenge all of you, working with your students or with your colleagues who are PTAs, to please consider membership and becoming involved in our academy.
Great. Thank you.
Thank you. All right, so I want to talk a little bit about education. We had our strategic planning last night, and this was one area that we discussed about wanting to be able to continue to offer more avenues for education. So you will find there is an online submission form if you go onto the APTA Oncology website. So I encourage you, if you have been a CSM presenter this time and you already have your slides, why don't you just submit one of those and we can get you recorded and get you up on the website so more people can hear your talk, because you put a lot of work into preparing your talk for CSM. And I think it would be great to continue to share your education and information out to the rest of the academy who wasn't able to come to CSM. But we do have a few online courses already recorded that you can find in that area. Katie Schmitz did a CIPN course. And these are little smaller chunks of courses, so an hour and a half, 2 hours, that you can sign up to purchase and learn a little bit. And then our wonderful lymphatic SIG, Candace in the back over there, some of her members have also created a couple of modules as well that are available for purchase on our academy website. One of the things that came out of the strategic plan last night was being able to understand how to create a course. So I know some of you might not feel comfortable creating a course. You may have never had to create a course from when you were in school. So one of my goals for the next little bit of time is to kind of help create a checklist and some ideas to help be able to get you going in that right direction. And so if you have questions about creating courses, or is this an appropriate course, or all of that sort of stuff. You're gonna see more stuff coming out from us to help guide you and prepare you to be able to share that information. So it doesn't have to be an all-day course. It could be a couple-hour course, a half-day course. You know, we want to be able to provide more information and more education to our members. And then lastly, we're just going to update. We are going to be making some changes to our website. This is going to be a little bit of a process, but we are very hopeful that by changing to a new website, we are going to have more interaction and communication. Mary Lou Galantino was on a couple calls with me, and you know, it's going to allow us to have what we call communities, where our SIGs can be able to have a pathway to discuss other than the listserv. There can be discussion boards, you can post questions, it can be limited to your SIG, or you know, you can post it to all of the academies. So I'm really excited about it. I'm hoping that it will just continue to flourish the way that we're able to communicate, and we can see all of the great work that you guys are doing out there, and have an avenue to share, because I feel like that's probably one of the most important things.
Yes.
Chris, is this when you want to talk about balance and fall course?
Sure. Yeah.
So the balance and fall SIG, Rachel stepped out. She was just here. She's the outgoing balance and fall SIG chair. I am just the one who drafted the syllabus for the SIG. They put together a synchronous, asynchronous course, which is the old regional face-to-face course that we did on steroids. It is 17 hours. Wow. All right? It's a real course, guys. It is 15 hours of asynchronous lectures with quizzes set up for CEUs, etc. The modules are pretty, I would say, relatively consistent when you have this many different contributors to the course. And then there's 2 hours synchronous session at the end of the course where you round on cases, right? So probably most likely over Zoom. And that course is like 95% done. They're finishing up the post-test quiz and stuff like that at this point. So you should be hearing about that course pretty quick. It is not a basic course. It is an advanced practitioner course. So I want to make that very clear, because our courses are open to anybody, but there are some people who are not going to have basic oncology knowledge they need to take this course. All right, so guys, be careful about this.
Yeah,
You're in trouble again.
Thanks, Cindy. I appreciate you bringing that up. That was something else we talked about last night, is making sure that we have courses for everyone. So that's another goal of mine, is to create a curriculum map. So we've got some beginner level courses for newer grads, more entry level practitioners, or maybe practitioners who just haven't ever been able to step into oncology yet. And then we'll have these more intermediate courses and then advanced level courses. So yes, thank you, Cindy, for bringing that up.
So I'm going to take 30 seconds personal privilege, because I'm old. I get to do this, right? So I got to thank Erlenka Corrigan, who's a neuroclinical specialist from NIH, who actually, after I drafted the syllabus, took the bit between her teeth, lined up many, many people to teach in this course, and has taken it home. And it's been a ton of work, and the Balance and Fall SIG for sponsoring it and taking the task on. And for any of the, in fact, instructors in the course, if you are here, please stand up and be acknowledged. Come on, you're there. Franny, you're there.
Thank you, Cindy. All right. I'm going to see, is we have a foundation rep here yet? Anyone from the foundation for PT? Still checking in? All right. Then our next item on the agenda is the research committee to announce some awards for the research. Is that you, Steve? You've got some certificates. That looks like it might be you.
I thought we're doing this at the Celebration of Life.
Oh, okay. I had it on this agenda, but we could do it at Celebration of Life.
Right?
Yeah, that's fine with me.
Yeah.
Yep. Well, just so you guys know, we're going to be announcing poster and platform award winners and the research grant at the Celebration of Life. So if you see it on this agenda, haha, just kidding. All right. So,
Chris, can I talk a little bit about evidence-based practice? Just for
please, yeah. No, we're going to be shifting in.
We're
We're going to be shifting into our open forum discussion. So now it's a perfect time. So welcome, Laura.
Perfect. So I just want to acknowledge the fact that there are a lot of members who are out here who've been working on evidence-based practice documents or evidence-informed practice documents. We had some amazing presentations at CSM this year. I want to thank the Cancer Fatigue CPG group, they did an amazing job today, so thank you very much. They are looking for help, and we are looking to you. There's not only that project that is ongoing, we also have a current update ongoing for the lymphedema diagnosis CPG, which we could certainly use some help on. And then we have to really think hard about how are we going to move forward our outcome measures, database information, and we are going to be starting to look at what are the most critical measures that we should be updating, and we're going to be needing volunteers for all of that. So please come hit me up, and I would get you connected with whatever your passion is if we're moving evidence-based practice documents forward in that. So we're doing a lot of work on your behalf, and it's really important work, so thank you.
Thanks, Laura. All right. So I don't think they're in the room, but I want to make sure that we recognize them for the minutes. Is none of this would really happen, I will probably say this again, at the celebration of life without a couple of our support team. And one of those folks is our executive director, Susie Callan. So I don't think Susie is here. And the reason that she's not here is she's setting up for the next event. And then the other person that none of this would really happen is without Jet Lee. She is our program chair, and she's been doing this job for a long time, and we want to keep her happy. So if you see Jet, hug her, whatever you need to do, keep her happy, because this is a really, really tough job. CSM is a beast, and it's really, really important. It's kind of the cornerstone of our engagement with the membership and getting everyone to come and facilitate. And we're working with APTA National and many other of the sections/academies, and it's a really, really complicated project. So when you see Jet, and maybe she's be the one handing you out drink tickets, please give her a sincere thank you, and not just for the drink ticket. All right. So with those, I wanted to open it up for some open discussion. I wanted to kind of hear what you guys have. I know we have a couple of SIG leaders or group leaders who might want to share some information as well. So if anyone has any comments, questions, ideas, what should we be focusing on for strategic planning, whatever we need to discuss or talk about. Don't all start at once.
Okay, this is just a comment, I guess. I just wanted to give a sincere congratulations to all the award winners. This evening, last year, I was outgoing chair of nominations and awards, and there are four awards, I believe, this year that received no nominations. So I'm not sure. Last year, we awarded clinical excellence for a PT and a clinical excellence for a PTA, but there were also two new awards last year that didn't get any nominations, and this year as well. And I think that's helped me out. I think that's advocacy for cancer survivorship by a PT or a PTA. So please consider your colleagues for those awards next year.
Well said.
Well, and are people aware? Because maybe that's part of the problem. Are people missing the communications? I don't know. I was sort of having a comment that sometimes, because the email does look similar week after week, sometimes it's easy for us to miss the content that may be new. So are people just not seeing those? So I don't know if the issue is that there's no one to nominate versus, or it's too much of a burden. So I think, I'm not necessarily asking for people to provide that feedback, but I think that would be helpful to share with Susie, and she can share that on if you want that to be anonymous. But there are really amazing people out there that should be recognized for the work that they're doing.
Absolutely, and we were talking about that at our strategic planning meeting, and I think that does align very well with our website. And one of the other things that is on my personal agenda, Franny's kind of has the walkthrough for taking continuing education. I'm making it my personal commitment to, we need to orient our members to what the heck the Academy has and can offer. So what the heck a SIG is. Some people don't know what that is. If you've been around, maybe you kind of got it by proxy and just kind of chit-chatting with people. But who do I reach out to if I have questions about X, Y, and Z? you know, if I have questions about specialization, who's my person? If I have questions about how to go through residency. So, you know, we're gonna be probably starting a soft launch of an orientation for new members and certainly make that available to existing members. And I say soft launch because we're gonna do it kind of on a trial basis because, as Franny said, we're gonna be transitioning to a new website. So we don't wanna make it super perfect and then have to throw it out. But it'll be a good place to start, and then really kind of update that on a regular basis so people know where things are at on the website, specialization guides, and how to submit a course, and how to learn about what's at CSM, how to do awards, and all kinds of things like that. So we're gonna think about what are some of the different ways to do that. And again, your feedback is gonna be really helpful. So if you have ideas of how we can kind of do that concisely and usefully for our membership, I think that would be very, very valuable. Cindy, did you have something?
Yeah, so, I don't care if I get in trouble tonight. So I'm gonna ask to do an awards nomination from the floor on advocacy, because I cannot stand to see that award not given out. And there are two people that I don't even have to think about, Betsy and Paula, for their work on the implementation of the National Lymphedema Act. On behalf of the Academy, guys, this is a no-brainer. Can we do a motion from the floor?
We could if you wanted to, yeah.
I move that we in fact grant the Advocacy Award to Betsy Campione and Paula Stout for their work on the National Lymphedema Act implementation, which actually benefits our patients. We serve.
I have to say though, is Ranjan here?
She had to leave, she had another meeting.
All right, add her name.
And Fiore and Karen Fox, so there's a lot.
That group deserves absolutely an advocacy award.
All right. So I'm excited I get to flex my parliamentary muscles a little bit. So it has been moved and seconded to nominate that group at City Hall.
I don't need to go any further.
Is there any debate on the topic? Emily, do you have the names that you needed? Okay. We'll work on spelling if we don't spell them right. Don't worry. We've got all your names in the member directory, so. All right. It has been moved and seconded, and is there any other debate that we need to hear about from this? All right, all those in favor, say aye. Aye. All right, all opposed? All right, the motion carries. All right. So, while we have that, do you want to talk about the Lymphedema Treatment Act? And then we have our foundation rep after that.
Yeah, I'm your current lymphedema chair. Miss Betsy had to move on to different things, so I kind of picked up. We initiated for our members just earlier, or kind of late last year, early this year, kind of awareness of what our problems are with the Lymphedema Treatment Act. We've had a wonderful job getting this moving forward, and it's definitely opened the door for us. But there are definitely some issues in billing, some issues in coverage, and how this is going to impact us. So for those therapists out there who are CLTs who haven't had a chance to voice their concerns, or for if you know people in your workplace who aren't part of these organizations, yet they have some very valid questions, we would love to hear them now, because I'm going to steal from Miss Cindy when we had a conversation earlier. We have a very narrow window to make some impact and change. There's going to be a point in time where this is going to be set, and if we don't make those changes now and get those solutions out there, and Miss Paula has been going to CSM directly for us to really get this moving forward. So any input helps, because we can make those changes now. And if we wait on it, we might lose some options for our private practices, our billing abilities, and our overall coverage for our patients. So yeah, we're going to be sending out some stuff. We already had one. I'm just going to revise it and resend it out to the group for later on in a couple of months. And then we'll start also doing some meetings to kind of get like one-on-one interaction with our members. So yeah.
So just to take a step back, I had to look down at my notes for a second. I want to make sure it was in there. Do folks kind of generally know what the Lymphedema Treatment Act is, or should we kind of mention it? I know some people are aware of it, but Candace, do you want to kind of give the elevator speech on what it is and why it's important? We kind of alluded to it.
Well, I didn't really build it like some of the people in the room, so I don't really think I'm qualified. But as far as it goes, for people who aren't lymphedema therapists, one of the biggest obstacles for our job is that we have known for a very long time that governments are needed for long-term management and control. And a lot of insurance will cover them, but Medicare, up until just this year, said we weren't going to cover it. So we would get Medicare patients, we would try to go for all sorts of public initiatives, all sorts of donations and charities. We had reps giving us items as much as we could, but ultimately speaking, there's just too many Medicare patients with a swelling disorder out there and not enough supplies. And so really and truthfully, our lovely staff that have been able to get this moving forward has really revolutionized the game plan for memory care patients. They can get the basic necessity for care. They get garments every 6 months, as well as nighttime options. They get liners, all these things that make why a lymphedema therapist is so important to make these decisions. We now have coverage for them. And it's still a work in progress, but it's a great first step to get things moving. And now we can kind of just refine and tweak it as opposed to build it from the ground up. So yeah.
Yeah, and this is really historic. So I think this is really something that's very exciting and very important. And for us, it's been extremely common sense. But some of these things, you know how there's kind of that look, oh, it's going to take an act of Congress to do this. This literally took an act of Congress, and we know how awesome that is right now. So it's really been an uphill push for that. And thank you to everyone who's been any part of that. So it's really been an amazing team effort. Cindy?
So you know what I'm going to do. I'm going to talk about the history of this. 10 years. 10 years to pass this law. Yeah, total. When you put it all together. Well, it took a while to write it, right? To actually draft it, et cetera, and get it out of there. But this brings up the partnership with Lana, and I think this is why the history is important, right? So there are, I'm sure, members of Lana sitting in here. There are PTs who are members of Lana. But this brings me not just to the history of this act. Betsy, I'm going to put you on the spot. For the first time in the history of Lana, there is a non-physician president, and it is a PT.
Yes.
Yeah. Actually was a partnership between this academy and Lana and some other groups and certainly patient advocates. So guys, it took a village, but we got there.
Yeah, well said, Cindy. So now I would like to invite our foundation rep to come up and talk a little bit about the Foundation for Physical Therapy. Thank you for being here.
Thank you for having me. I see lots of familiar faces.
We warmed up the audience for you, so you're in good hands.
I'm Barbara Conley from the Foundation for Physical Therapy Research. I do see lots of familiar faces, so that's always nice. And I always say I love to come and talk with your group because I'm a 25-year breast cancer survivor. So I'm not gonna take long, and I'm not gonna pass out envelopes like the PAC does. It's lovely to say that. But I wanted to, we are now celebrating our 45th year as a foundation. But Barbara, Mom, and I looked back. We were actually a part of the 1947 organizational PAC for research in PT. So we've gone through several names, but this is our 45th year. And we will be celebrating our researchers and our donors all through this year. I wanted to bring you up to date with what we have done this year and what we have done in terms of funding. This last year we did $1 million funding for 10 students, our pods 1 and 2, and we also funded quite a number of grants in that $1 million. Over our history, we've supported 700 researchers, and we have, and I have to get the numbers right to make sure that this is true, we have spent about $23 million, but those 700 individuals have gone on and have gotten $930 million of carry-on funding on. We are so thrilled with what we're able to do as we provide support for the researchers, for the pods, for students, and then for our research grants. And the reason why these individuals are so successful is because we use the NIH format for development of the proposals. So it prepares the person that we fund to go on and get more of those dollars. So you have to be assured that we are being good shepherds of your money that you donate to the foundation as we are preparing researchers that help us. And I always have to stop here and say, help us as consumers of research. You may not be researchers yourself, but we're preparing those people that will provide that evidence that we need to carry us forward as a profession. One of the things that it came to our attention today is that there's a lot of students that are getting into their PhD programs, EDD programs, or SCD programs. So we fund doctoral level students at all of those levels. But we're finding, given the number of doctoral students that have stopped by our booth yesterday and today, a lot of them don't know that we do provide funding as a PODS 1, and this is when they are in probably their second year, for some it's longer than that, for funding. And we fund at the level of $7,500 for that PODS 1. A PODS 2 is $15,000. And that really does help these doctoral students as they're going forward. So thank you for your support. Some of you should be expecting annual calls from me for the President's Sustaining Fund, which is our funding for unrestricted dollars to help the foundation, not just with the grants, but with the functioning of the organization. I have some sheets here with a barcode where you can scan that in and it will take you directly to the foundation website, and you can learn a little bit more about the grants that you might want to be interested in. We have grants that are $40,000. We have grants that are $150,000. So a lot of range in terms of what we fund. So thank you again for all your support. We welcome any donation, $5, $10, $100, $1,000. We don't get maybe 5,000, but certainly we would appreciate that too. So I'll leave these, and if you want to get a little bit more about the foundation, you can scan that in and get more information. So thank you for having me, and thank you for your support of the foundation.
Thank you so much. So, other thoughts? Yes, do you want to speak?
Hi guys, I'm Jen Bernstein. I am the Academy's Specialization Chair. And I just wanted to take a few minutes to give you guys some updates on some of the things that we're doing for our specialists, new, old, kind of transitioning into this amazing program that we have. We are going to beef it up, and I'm so excited. I have heard you guys loud and clear that this needs some love, this needs some work. So I have a list that is going to be sent right to Chris Wilson when this is over, and we're going to get some really cool things going. One of the things that we just accomplished, which I'm really, really proud of, is a 2-hour free webinar called Stories of Specialization. This was in January, and we had an amazing panel of specialists, and we just got to really talk about our why. I think at the end of the day, we all have our why, and it may be different than somebody else's, but at the end of the day, we all want to be specialists for a certain reason, and so why not share that with others and kind of pull them into our group. So this webinar is now on the YouTube channel. I have a QR code on my phone, so if anyone wants to scan it, watch it, please do. If you have people in your clinics and that you work with that are interested in specialization, direct them to that webinar. It's a great place to start. From that webinar, I was able to make some study groups for people all over the country and kind of connect them with each other. We're going to be updating some resources, so lots to come. If you guys have ideas, I know I had lots of ideas after I went through the process in 2020, so if you guys have ideas, don't hesitate to reach out to me. We're going to get all of my contact information up on the specialization section of the website, so you can totally contact me from there, or I'll be around tonight. But I just wanted to let you guys know that this is now my mission. We are going to make specialization really awesome, so be on the lookout.
Thank you. We've got just a few minutes left, but we want to open it up for any other discussion, questions.
I'll follow
Jessica?
Jen. So we did an information session about specialization and residency education today. It was really well attended and engaging, and there were a lot of interested people in both specialization and residency education. So we're going to honor the current residents in Celebration of Life, so I don't want to spoil that, but we have 8 residency programs, and Chris and I made a commitment earlier today that we're going to double that in 10 years, and I'm going to make a pinky promise later. But if I just want to put it out there, if one of the missions that the residency SIG has is to be able to support not only the current programs, but but also organizations that want to start residency programs. And now that we have 3 residency programs that have completed reaccreditation, we have some experience and we kind of know what we're doing. And so I would just encourage you all, if you talk to someone or know someone or an organization that's even kind of interested in starting a residency program, connect them with our SIG so that the other residency programs can come beside them and help facilitate starting a residency program. I feel like it's an excellent path to specialization, and it really helps to grow our profession and just our value of oncology rehab.
Nice. Cindy? Good job, guys.
All right, guys, so I'm gonna piggyback on this residency education thing. I'm an on-site reviewer for residency and fellowship education. We are in desperate need of clinical specialists to serve as on-site reviewers, as content experts on those 3-member teams, right? So, one of those responsibilities of clinical specialization downstream, when you're in a residency program, give back. Because we need those content experts on those teams. You know, we're one of the areas where our practice is so broad and multi-system that it really does take very unique individuals to be able to be content experts in oncology. So please consider serving down the road. Doesn't have to be today, doesn't even have to be tomorrow, not even next year, but your long-term career trajectory, please. Guys, I'm heading into my 8th year. These are three-year appointments. I am done in a year.
We'll see.
I promise I'm done.
Yes.
I just wanted to invite, we need some writers for the oncology section, so if we could get some people, some newly certified people, or anybody that is interested in doing some item writing, feel free to contact me, Dr. Mars, or Elena Newell. She's on our council, but we could really use some fresh writing, so please come.
Absolutely, and it's a great opportunity. So I just wanted to, since I have a microphone, I get to take a little point of personal privilege and talk about a topic that's kind of serious is imposter syndrome. Is some people, it's a real thing, and it is something that we need to kind of support our newer members through. And I'm here to tell you right now, in person and virtually, is you don't have to be afraid of that with this group. Literally, this is a family, and we're here to support, we're here to coach, we're here to mentor. So if you have one of those gut feelings that says, oh my gosh, I just got board certified, I'm not qualified. And it is one of those things where it does take a little bit of professional bravery, but we are openly inviting you, as we are here to mentor, to support, not to judge. You are not being judged if you don't know a process, if you don't know an abbreviation, because APTA, we like our abbreviations. And I don't know what they all are, and I've been around for quite a long time. And if you've ever, one of my best mentors in APTA Michigan, some of you might know her from Michigan, Jake Kubiak-Kovacic, she told me, and this rings true, if you're not embarrassing yourself once in a while, you're maybe not trying hard enough. And I have taken that to the nth degree, and I embarrass myself all the time, and it totally works. So if you're kind of thinking like, oh, I don't know if I should be involved, I don't know if I'm qualified to serve on one of these committees or participate, put yourself out there professionally, because maybe if it's not for you, it's for your patients. And we as therapists, we want to do everything for our patients. So, hopefully come out from this meeting with a little bit of that thought of, I'm going to put myself out there. It's okay to be a little bit embarrassed every once in a while, because that means you're trying hard and you're trying something new, and we welcome you and we recognize you for it. So with that being said, I'd like to entertain a motion to adjourn. So moved. All right. Hold on. Wait, we have one more thing. So it's been overruled. Lori, do you want to? 2 things. Go ahead, Mary Lou. Yeah.
If I may. Firstly, I'm Mary Lou Valentino, and I really want to say thank you to the executive board on behalf of our outgoing president, Roberto Sandoval, who we presented yesterday together. Talk about fresh, talk about exciting, talk about passion. we rebranded the HIV Special Interest Group. The bylaws have been changed to the Immune System Disease SIG, which actually, on the heels of COVID, who would not know, who wouldn't want to come into the SIG, but we have typically had maybe 1 or 2 people come to our meetings for the last decade, and the HIV SIG was established back in the early 80s. I've been around a long time, but we rebranded it, and there's something about rebranding and then having new faces, new members, and we had a crew that showed up yesterday that was for the first time over 10. So I just want to say on behalf of all of the SIGs with so much passion, we're small but mighty. And to your point, Chris is our illustrious president who echoes those words of, you know, really coming into the family. It is that we have been around a long time. We love each other and support each other, and we really are here for all of you. So for me to see enthusiasm, new faces, new members, new clinical specialists that we get to celebrate tonight, congratulations everyone, and thank you.
Thank you, Mary Lou.
Hello, Mary Lou, but good evening, everyone. I'm Lori Bobright. I guess I'm going to say 2 things, because I'm the newly appointed Hospice and Palliative Care SIG chair. We are meeting tomorrow at 10 a.m. So we would love to see new faces and interact with you guys as well. On behalf of myself, Chris Wilson, and Deb Doherty, who cannot be here, we are going to be raffling off a couple of textbooks during the Celebration of Life. If you did not get a little piece of paper from Susie, she can give you one as you go into the Celebration of Life, because we want to give a couple of signed copies.
Bravo!
Jack, do you have something to say?
My name is Jenny. I'm the program chair for CSM. I hope you are having a good experience. I have the drink tickets. And also, I just wanted to announce that, like, even though CSM is ongoing right now, the submission portal for CSM 2025 is actually open already. I know. The deadline is April 15th. If you are a new speaker and want to submit and you just want to kind of know the process, please email me. I can walk you through the process. The submission process is very, very straightforward. Your proposals get reviewed by a review committee. And then we sort of try to put together a slate for next year for CSM 2025, which will be, so April 15th is the deadline. For educational sessions, thank you. If you're presenting an abstract for a poster or a platform session, those deadlines are a little bit later, and Dr. Andy Ray is the head of the research committee that will review that. Right? And
Yes.
even Dr. Linda Kohler. Yes. Thank you.
Thank you, Jack. Cindy, do you have the last words, Cindy?
And since Rachel stepped out, I feel compelled to remind people the Balance Involved SIG meeting is at 1 o'clock tomorrow.
Perfect. All right, now I will entertain a motion to adjourn.
Aye.
And it has been moved in second. All in favor to adjourn and go to Celebration of Life? Say aye.
Aye.
All right, we are adjourned.
Right at 8.
Good job. Good job, team.